fertility issues are becoming more common.
Yes.
Is it more common now because of whatever's happening in the last 10 years in the environment, or is it that we are picking up a lot?
It's both actually, and it's multifactorial. We are also picking it up more because people are now slowly getting over the stigma surrounding fertility issues and coming forward to get the help they much needed, whereas back in the day it was more common for them to continue suffering in silence. But the incidence is also on the rise. The incidence is rising because of multiple reasons, but what I feel the commonest being lifestyle and environment. With lifestyle, the single most important determinant of a couple's chances of conceiving is the age of the female partner. Because when we are born, unfortunately, we are born with a limited number of eggs.
So you're saying age does matter.
Of course, it matters. It's the single most important thing that matters. When a woman is born, she's born with about 20 lakh eggs in both her ovaries combined. And that's it. After that, she can't make a single new egg. In fact, it's like being born with a fully charged battery, a 100% charged battery, but the charger is not given to us. So, right from birth, that battery is going to start reducing. This is what happens to the quantity and quality of eggs. By the time the girl gets her first period, from 20 lakhs, this is already down to 4 lakhs.
20 lakh eggs is when they start menarche,
When they are born.
when they're born.
When menarche happens, it's already reduced to 4 lakhs without getting a single period. In the first 10 to 12 years of life, it goes down from 20 lakhs to 4 lakhs. When the girl is in her 20s, 20 to 30, is the age of peak fertility because the quantity of eggs is good, the quality of eggs is good, chances of conceiving are high. After 30, there is a more rapid decline. So, an accelerated decline starts in quantity and quality. As we are approaching near to 40, we are left with our last few eggs, most of which may be too weak to give rise to a pregnancy. That's why, as we get older, our chances of conceiving keep dropping. Now, what happens is that you asked me the incidence is rising. If we ask our mothers how old they were when they had their first child, most are going to say 20, 21, 22. Back in the day, probably even 25 was considered too late. But nobody is getting married that early and having babies now. For the women of today, and maybe rightfully so, there are so many competing priorities. Education and career are just as important for the girls as they are for the boys. And sometimes you just haven't found the right partner yet. So those peak fertility years go by very quickly before you've even thought about starting a family. And now, when people get married, very often in the early 30s, sometimes late 30s, sometimes early 40s, the biological clock has already slowed down for the women. Say, in one generation itself, we have gone from trying to conceive in the early 20s to trying to conceive now in the late 30s for most couples. But evolution doesn't change in one generation. It takes millions of years to realize that it needs to catch up. So we are still aging the way our mothers were aging, but we're not conceiving at the time when they were planning their first child. So age is one of the most important factors why more and more couples are struggling to conceive now.
Choosing the right partner is the problem here.
Yes.
In many cases, people say arranged marriages were better, but not anymore, right? We are thinking that there's a lot of school of thought is that it's better to have the right partner rather than having a family with a wrong partner.
Absolutely.
So it is difficult to choose the right partner in the first 20 to 25 years of age, or even 25 to 30.
Yes.
And then when let's say they find the right partner and then they go into 32, can you tell me in numbers in terms of how many eggs they may have and what is the risk that they are taking if that is what they want to do?
So, what we say in scientific terms, and then let me explain that to you in simple terms as well, is that the rate of oocyte apoptosis varies between individuals.
Oocyte is the egg.
Egg.
Apoptosis is disintegration.
Yes. So, the biological age does not always correlate with the chronological age. Now, to put this simply, what this means is that some girls in the late 20s or early 30s itself could have a very low ovarian reserve because their ovaries have aged faster. And some in the late 30s can still have a larger ovarian reserve. So sometimes when girls come to me and I check their ovarian reserve and I find that it is low, They may be surprised that I'm only 28 or I'm only 31. How can I already have a low AMH or a low ovarian reserve? What I explain to them is that this is an aspect of aging. And just like any other aspect of aging, it differs from person to person. For example, white hair. It's a part of the aging process. But
Yes.
some people have white hair as young as 30, 35.
Yes.
Some don't have any white hair till 45, 50.
Correct.
Because it's different for everyone. So similarly, though the ovarian reserve by 32 should still be, reasonably good, but in a lot of cases that is not the case.
You mentioned about AMH.
Yes,
Is that a blood test
it is a blood test.
which can give you a sign of the ovarian reserve?
Yes.